Adolescents seem to have a lot of problems. One of them is they sometimes experiment sexually. How would you be involved in that kind of a situation?
The statistics say that during the adolescent high school years, that by the time adolescents graduate high school, up to 60% have been sexually active. So it's more than just experimental, it's actually a pretty common event. The teenagers who are sexually active obviously run the risk of pregnancy, and they run the risk of sexually transmitted diseases, in addition to other psychological issues that may develop by being sexually active and not necessarily psychologically prepared. In our division of adolescent medicine, we take care of teenagers who are sexually active. For the girls, we provide contraception if necessary, and we certainly do sexually transmitted disease testing. And for the boys, we do STD testing, and we also do condom provision.
If a teenager was sexually active and they came to you and they said, I want to be tested to see if I had any sexually transmitted disease, what would you tell them?
Teenagers are able to actually be tested for sexually transmitted diseases or provided contraception confidentially. So there are teenagers, and most teenagers actually do want the kind of care that's necessary for sexually transmitted diseases or contraception to be done confidentially. So we have the capability of providing it confidentially. We do testing for the girls. It usually involves a gynecologic exam, but there are newer tests where one can actually do it on a urine, and for the boys it generally involves a urine.
There's a new vaccine out called Gardasil. It's something about a cancer-preventing vaccine. First, do you recommend it, and can you tell me a little bit about the vaccine?
Gardasil is a vaccine that just came out within the past few months, and it's for the virus that's called human papillomavirus. It turns out that 99.9% or more of cases of cervical cancer are due to human papillomavirus, and it also turns out that if you check teenagers or young adults who are sexually active, somewhere above 30% at any time will actually have a type of human papillomavirus. There are many human papillomaviruses that most of the cases of cervical cancer are due to types 16 and 18. Human papillomavirus can also cause what's called cervical warts or vaginal warts, and those are due to type 611. So the new vaccine, Gardasil, is a vaccine that prevents people from getting human papillomavirus types 6, 11, 16, and 18. Therefore, those who get it, and it's a 3-dose series, those who get it should be not at risk for cervical cancer, except the rare cases due to other types of human papillomavirus, and also not be able to get, in the future, not be able to get any kind of vaginal or cervical warts.
But to give the vaccine, we have to make sure they're not sexually active first. Is that true?
No, definitely not true. The vaccine is at this point in time is recommended for ages 9 to 26. It can be given to those who are sexually active, and it can be given to those who are not yet sexually active. As a matter of fact, it can be given to somebody who already has one of the human papillomavirus types. So let's say a person has actually had human papillomavirus type 16, they can still receive that vaccine to prevent them from getting types 6, 11, and 18. The studies that have been done show that there is no negative effect of receiving human papillomavirus if a person has had previous type of human papillomavirus, and in fact you're still preventing the other kinds. So at this point in time, they're focusing on the pediatricians in terms of learning about this new virus. The company that put it out, which is Merck, is focusing on the pediatricians for the younger adolescents, most of whom are not yet sexually active, and they're actually focusing on the gynecologists for the older adolescent and young adult, many of whom or most of whom have been sexually active. The idea is that if everybody ultimately, and so far it's only for females, they're not giving it to males, it's not at all approved for males, but if all the females of the age group of 9 to 26 get the human papillomavirus vaccine or Gardasil, then we have the potential to wipe out cervical cancer in the next few years.
What would be the youngest age group that you would recommend birth control?
Old enough to be sexually active, old enough to need birth control.
If a child used a condom, is he 100% sure he will not get any sexually transmitted disease?
No. The condom is the best way to prevent sexually transmitted diseases, but it is far from foolproof. It turns out that certain infections, such as human papillomavirus or herpes, are actually things that are passed from skin to skin, so that it's not uncommon to get those infections from one person to another, even if there is condom use. But on top of that, even the other types of infections, gonorrhea, chlamydia, which truly would not pass through a condom, there are episodes where a condom can break, there are episodes where it's not used properly, so it does turn out that even with condom use, sexually transmitted diseases are still a risk, but less of a risk than without condom use.
Thank you very much.